Hello, everyone. Welcome. I'm Anita, and welcome to Care Experts Live, brought to you by CareCredit. CareCredit is a health, wellness, and personal care credit card that has helped millions of people with promotional financing options and is accepted at hundreds of thousands of provider and retail locations nationwide. So I see that we already have some people in our live stream. Thank you so much for joining. I see Molly B, Carla M, Ashlyn, John M is here. Thank you all so much for being here today. So today we're going to be answering your questions about dental health. And a little bit later, we're going to be revealing the CareCredit Let's Get Digital Cardholder Sweepstakes Special Secret Word. So make sure to stay tuned for that. We'll be revealing the secret word about halfway through the show and again at the very end of the show. So let's meet our care expert. Today, we're going to be joined by Dr. Kellen Mori. Born in Brazil, Dr. Mori is a member of the American Dental Association and has over 30 years of experience. She practices in the heart of Beverly Hills and focuses on compassionate dental care. Dr. Mori, welcome to Care Experts.
Thank you so much. I'm very excited to be here, and I'm honored to be, answering questions. And it's my passion to be a dentist. So let's get this rolling.
Yes. So before we answer some questions, I just want to know, what do you do when you're not helping your patients?
When I'm not helping my patients, I am busy. I have three daughters. They are in the teenagers' years, and I love cooking. I love playing tennis, and that's my passion.
Did you always know you wanted to become a dentist?
I learned, I became a dentist mainly because I was very fearful of the dentist. I mean, I was so scared, and, I had many teeth and cavities, and I could never get myself to go to the dentist. And I was really, really scared. So when I became around 15 years old, that's when I decided that I wanted to be a dentist and help people with fear and
Yeah.
make sure that, they can go to the dentist and take care of their teeth.
Well, that's wonderful. And so I know we have a lot of questions. So the first question is from Matt S. And it is, I drink a lot of coffee and tea. How can I help keep my teeth white?
So drinking coffee and tea, it's a common thing, right? Everybody, these days, staying at home, working from home, you tend to drink more coffee and tea. I would say one good advice would be after you drink your tea, just rinse your mouth with water after you drink coffee. And if you're home, even brush your teeth right after so you can keep your teeth whiter because coffee and tea are, very stainy liquids that can cause all these discolorations.
So we have another question from Steve H. And he wants to know, are there any ways to help improve bad breath?
Bad breath, also called, known as halitosis, it's caused by several things. The main thing would be you're not brushing your teeth twice a day, you're in flossing. And also drinking a lot of coffee can cause bad breath. I would
Mm.
say, you have to really scrub your tongue or rinse your mouth with, any mouthwash because halitosis is mainly caused by bacteria. So if you're not brushing twice a day and flossing, if you're not going to your dentist regularly, you're going to have bad breath.
And like you said, you recommend brushing your teeth or at least rinsing out your mouth if you've had coffee throughout the day.
Absolutely. It's important to rinse because coffee, leaves that kind of lingering taste in your mouth. And, if you don't brush and scrape your tongue, that
Mhm.
can also cause bad breath.
So I have another question from Jennifer C. And she wants to know, how often do you recommend flossing your teeth?
Flossing your teeth is very crucial, important to maintain an oral health. I would say if you do once a day, you are doing your job. So brushing twice a day for 2 minutes and flossing once a day can keep you in a good oral health.
Would you recommend flossing in the morning, or is it best to floss at night?
It doesn't really matter, as long as you do once a day. It depends on your, daily activities when it's better for you. The most
Mhm.
important thing is to keep a good habit, a routine. So do it, the same time as you do every day. So you keep that routine in keeping your good oral health.
So we just had a question pop up from Vanley C. It says, what causes teeth grinding?
Teeth grinding is very common, and it's when you're stressed, you keep
Mhm.
grinding your teeth. It can happen at even early ages, and kids, you can hear them grinding their teeth. So mostly it's stress, or let's say you have a restoration in your mouth that is not adjusted well, like your teeth are not meeting properly, you start grinding it more. So it's a combination of stress and having restorations that were badly adjusted in your mouth, and
Mhm.
a night guard will be very helpful for these situations.
I'm curious, is that similar to clenching? Because I know some people can clench their jaw a lot. Is that kind of caused by the same issue?
Clenching, grinding are caused by stress, for sure. Clenching is more when you keep your teeth together at all times. You can feel
Mhm.
like this masseter muscles kind of tight. Your dentist can tell you if you are clenching or grinding when they do this, or examinations when you go for your checkups.
And so we have another question by Jamie J asking, is there a way to fix chipped teeth? And what would you recommend for that?
Absolutely. If you have a chipped teeth or tooth or many ones, there are bondings and composite resins that can restore your teeth. It depends how big they are. The chip of your teeth, they can be easily repaired by adding composite, which is same color as your teeth. The dentist will prepare the surface and adhere this kind of putty-like material, but it will restore to the shape that you had before, and also can improve the color of your teeth if they are discolored with some bonding.
So we have another question by from Azzy M saying, how do I get rid of gingivitis and how long does it take to get rid of it?
So, gingivitis, also known as gum disease. So, gingivitis is the first stage that your gums have some kind of infection. It's caused by bacteria and plaque. So, plaque is formed in your teeth when you don't brush well. So, it's like a film like coat over your teeth that can be easily removed. But if you don't brush well and floss, this bacteria, this film can turn into tartar. And the tartar, it's harder to be removed. So you need to go to the dentist and they scale and they remove all this tartar under your gum. So gingivitis usually can be resolved if you go to your dentist and have regular cleanings. I recommend every 6 months. And if you brush twice a day and floss, you won't have that. So gingivitis is easy to take care of. But if you don't go to your dentist, it can turn into periodontitis, which is the next step of gingivitis and gum disease.
Yes, and we don't want that. So I just want to shout out some people I see in the chat. We have Gary, Michelle, I see Rowan, KJ, Nancy, Jessica. Thank you all so much for being here. And I see we have another question by Rockstar Wellness is there any way to stop gum recession?
So gum recession, it can you can have gum recessions for several factors. One big one that sometimes it's hard to take care of is if you have some genetic components. You can be predisposed to have gum recessions if your mother or father, it's a genetic thing. But receding gums can be avoided if you go to your regular checkups and cleaning, so you avoid, bacteria and your mouth is clenching. All of these things can be avoided if you use a mouth guard, for instance. If you have heavy grinding and bruxism, that can cause gum receding. So go to your dentist and they can advise, what's happening in your mouth because it can be from several factors.
And you recommend visiting your dentist about twice a year, right? Every 6 months. That's the ideal amount of time.
That's the ideal. That's what American Dental Association recommends, and twice a year would be perfect.
And we have another question coming in from Colette C that says, what do you recommend for dental anxiety?
Dental anxiety, it's a real problem. Some people,
Mhm.
avoid the dentist not because of any financial problems, but they're really anxious. I would say, try to find a dentist that, works with anxiety. They have, special tools they can offer nitrous oxide, they can offer some oral sedative, or even for, extreme case of patients with anxieties, you can do intravenous anesthesia or even general anesthesia. So try talking to your dentist and see if they have all these tools to help you. Even sometimes you have patients that have to go to, you know, try to get a help, little by little getting used to going to the dentist.
Yeah, and I think over time you'll become more comfortable.
Yes.
So we have another question from Erica E. Do you have any tips for helping keep my kids' teeth healthy?
I think it's the same for adults. Make sure that you reinforce a good habit at home. Like, at night, everybody goes to brush their teeth at the same time. Or, if they see you brushing and flossing, they're going to learn by, just looking at what you do. So I think if you have a good habit, I think your
Mhm.
kids pick up that from you.
Great. So I just want to shout out a couple more names. I see Joshua, I see Erica, Richard, Colette, Steve. Thank you guys all so much for being here. We're so happy to have you all. I see Heather. We have Amber, Lena, and Nora. Thank you guys for being here. I know Dr. Mori has been just so informative, helping us answer some questions on a number of dental questions that we all have. So, Doctor, I just wanted to thank you and tell you how informative this has all been. But before we continue, I want to give a shout out to a couple more people like Elizabeth, and I see Sarah and Lauren. Thank you guys for being here. So, now we're going to take a short break to reveal the CareCredit Let's Get Digital card holder sweepstakes special secret word. Are you ready? So the secret word is teeth. So through October 31st, 2023, you can earn entries for your chance to win $5,000 in the Let's Get Digital CareCredit card holder sweepstakes. Enter the secret word teeth in the sweepstakes hub to earn a special 20 entries right now. Head over to the sweepstakes hub by simply visiting carecredit.com/let's get digital. So no purchase is necessary. A purchase will not increase your chance of winning. Legal residents of the 50 US and US territories, including DC, 18 and older, who have a CareCredit credit card as of 9/12/2023. Void where prohibited. Promotions start 9/13/2023 and end 10/31/2023. Sweepstakes grand prize and weekly prizes are awarded in the form of a check. For official rules, including odds, free method of entry, and prize description, visit carecredit.com/let's get digital. Sponsored by Synchrony Bank, 170 Election Road, Draper, Utah, 84020. Okay, so again, I want to say hello and thank you to Heather, Amber, Nora, Erica, Colette, everyone for being here. So we have some more questions coming in. So let's see. I want to answer Megan L's question asking, do you recommend a manual or electric toothbrush?
So when it comes to toothbrush, the electric ones are designed to do the work for you, with their bristles and rotating, they can remove all the plaque and food from your teeth.
Okay.
If you have a good technique for using the manual toothbrush, they can do the same kind of work. So I think you have to choose whatever works for you. I personally prefer an electric toothbrush. I think they clean better. I think you have a smoother surface. But some patients have financial problems. It can be costly to have an electric toothbrush. So it depends on your technique, but they both work the same way if you do it consistently.
And the ideal time to brush your teeth is about 2 minutes. Is that correct?
Absolutely. You got to brush for 2 minutes. And the best thing about the electric is that they have sensors. So you turn it on and you don't turn it off and let the whole cycle go. So you know you're doing for 2 minutes.
Yeah. So we have a question from Jess asking, what is the best toothpaste for sensitive teeth?
So for sensitive teeth, they have, Sensodyne, for instance, they have, it's better if you use something that has, materials that would be helping the sensitivity of your teeth. I would
Yeah.
say, don't use too abrasive ones, especially the charcoal toothpaste can be too abrasive. So use Sensodyne, it's best.
Okay, got it. And how long do you have to use Sensodyne before you feel it sort of working and desensitizing your teeth?
So every case is different, but I'd think at least 6 months to see any results.
Oh, wow. Okay. So let's see. We have another question from Zaria S saying there are differences between string flossing and water flossing. So is one better than the other?
Water flossing is easier to do it. You don't have to have the dexterity to hold the floss and kind of maneuver in your teeth. Uh, the regular flossing is the best. If you can do that, I prefer. I think you can get more debris out of your teeth. But for people that can use or doesn't know or has some problems with their hands, water floss will be good. So either or, you have
Yeah,
to floss your teeth.
yeah. So we have a question from Claire T asking, what exactly is a cavity and why do they happen?
So, cavity is when a surface of your teeth, the outer layer, the enamel, has been taken by bacteria. So you don't floss, you don't brush. So these areas of your teeth becomes kind of corroded. So bacteria gets inside your tooth and starts kind of taking the enamel down. So creates a little holes in your teeth. So you have to go to your dentist because it's a process that won't stop. Once a cavity starts in your teeth, you have to go to your dentist. You have to take care of it because it will go into the other layer, the denting, and the next layer, the pulp, and then a simple cavity that would be filled. If
Mhm.
you wait too long, it can turn into a root canal and be way more costly.
I have a question, Dr. Mori. I was wondering, I know when you're little, your parents always say, don't eat too much sugar, you're going to get cavities. And so is that true or is that a myth?
Oh, it's absolutely true.
Mhm.
Sugary stuff and can break down and go into your teeth and interact with bacteria and cause cavities. So you have to avoid sugary stuff and even sodas, anything that can break down and
Got
feed these bacteria in your mouth.
So we have a question from Johnny R saying, what are veneers?
So, veneers is a cosmetic dental procedure. They can be made out of porcelain or composite. They are mainly to improve the look of your teeth. Let's say you have a broken down teeth or you have a teeth that has a lot of bonding
Mhm.
or discolorations that whitening doesn't work. So, veneers are a thin layer that you place over the front surface of your teeth only. You don't prepare like a nub. People
Yeah.
are scared of veneers because they think you're going to take a lot of your teeth out. But it's a very minimum preparation over just the front of your teeth, and they can last a long time. They can improve the color, the shape, and they can make your teeth white, and you won't discolor drinking coffee or red wine.
So I just really quick want to shout out a few more people that I see we have here in the live. We have Amy, Bia, Annette, Veronica, Amanda. Thank you all so much for being here. And I see we have a question from Amanda O. What should I keep in mind when looking for a dentist?
So, when looking for a dentist, I would say the best way to start is asking for recommendations from your friends, from your family or coworkers. It's
Mhm.
it's important to find a dentist that have a good open communication with you. You need to know office hours, for instance. Do they offer Saturday hours? Do they offer any specialty? Or if you have an emergency over the weekend, are they open? Are they going to be there to help you? And if you need any specialty, do they have any specialist in their office for root canal, for oral surgery? So it's important to check their credentials. Are they affiliated with American Dental Association? How many years have they been practicing?
Yeah.
Another way would be, check their Yelp reviews, because sometimes you don't know what you don't know. So do
Yeah,
your due
exactly.
diligence. Yes.
So we had another question from Brian asking, what is a dental bridge?
A dental bridge is when you lost a tooth. Let's say you had a bad tooth, the cavity was so extensive that it couldn't be saved. So they have to extract that tooth. So there's an empty space. So a bridge will be using the tooth in front and the tooth behind as anchors to hold this pontic area, could be one or more teeth. So a bridge will be connecting by two adjacent teeth, and this way you can restore your function, you can occlude, you can chew your food properly.
Mhm. And so I see that we had some questions about Invisalign. And who exactly would be a good candidate for straightening their teeth?
anybody could be, a candidate to straighten their teeth. So there's several levels. So, clear aligners is a great popular way because, it's more custom made, it's clear, you can remove, and, it's a popular, way to straighten your teeth rather using the conventional brackets, the metal with the wires that, it's a little more, we people these days, they're very, they want to look
Yeah.
good and feel good.
Yeah. Is there an age range that you recommend starting the clear aligners? Like, do you have to wait till your teeth are at a certain point before you can use them?
So clear aligners, you can start on your teenager years. Let's say
Mhm.
if you're 13, 14, 15, you can start with clear aligners. If you're younger, you would prefer to have, the regular orthodontics because sometimes you need palate expanders, if you need to open space in your art. So Invisalign, it does not work for, younger age.
Yeah. And I know you have to be pretty consistent when wearing those too, so for them to actually work.
Yeah, if you don't use them for 22 hours a day, it won't work.
Yeah. So we had a question from Tommy C saying, "How often should I go to the dentist?"
You definitely should go to the dentist twice a year. Every 6 months, you should go for a dental cleaning and a dental checkup. The dentist will check, not only your teeth and your
Mhm.
gums, but they're going to check the muscles of your face. They're going to check your sublingual glands. They're going to check for oral cancer. So there are many things that does not just involve cleaning your teeth in your mouth, but the dentist is responsible for your oral cavity and everything in your face.
And I had another question saying, "At what age do you normally need to have your wisdom teeth removed?"
So, wisdom teeth are the third set of molars that come into your mouth. Usually, they come between the age of 17 to 25. If
Mhm.
they come in and they are in a good position, you don't have to remove them. So, not every wisdom teeth needs to be extracted,
Got
only
it.
if they are causing problems.
I guess that means if they were coming in and causing overcrowding, then you would definitely need to remove them.
Yeah, sometimes you don't have the room for the wisdom teeth.
Mhm.
Our ancestors, they had, bigger jaws and they chew harder foods, so the wisdom teeth were necessary. But with the evolution of our diet and the size of our jaw, we don't have the proper space for them. So you have to check regularly. You take a
Mhm.
panoramic x-rays and the dentist can tell you if they're going to be impacted, if they're going to come in. So you take care of that as soon as you know that they're going to be causing some problems.
Awesome. So I just want to shout out a few more people. I see Mo, Jolie, I see Angela, Robin. Thank you all so much for joining us with Dr. Mori. I see a question from Crazy Kitty asking, "How long do root canals normally last?"
So, root canal is when you have a cavity in your tooth that's way advanced and went into the nerve. So, you do a root canal. They remove this bacteria, they remove the nerve, they
Mhm.
clean. So, a root canal can last for a lifetime if they're well done and properly cleaned. Um, so, I would say, if it's well done, they can last, for the rest of your life. There's no expiration on a root canal.
If a patient was going to get a root canal, is there certain things that they need to do beforehand to prep for a root canal?
No, root canal, it's a very fairly normal procedure done in dentistry. You might be a little sore afterwards, but you're not going to miss work because you had a root canal.
Got it. That's good. So, what are some common bad habits that you just recommend avoiding just to keep your teeth and mouth overall healthy?
So, bad habits, number one, I would say if you don't brush twice a day and floss, that's a really bad habit. Another one is using your teeth as tools to open packages or to, hold.
Ripping
Another
something open.
would be, chewing on ice or chewing on pen,
Okay.
smoking tobacco or chewing on tobacco. And what else can it be a bad habit? Eating too much sugar. That's a
Mhm.
bad.
Yeah. So we have a question from Nikki P asking, "Tell us a little bit about what periodontal disease is."
So periodontal disease is a bacterial disease that affects your gum. So the first stage is called the gingivitis, when you see that your gums are red and they're puffy and they bleed very easily. Even by brushing your teeth, you start bleeding. So that's the first step.
Mhm.
Um, you go to your dentist and get a good cleaning, get a good habit. If you don't take that step, the gingivitis is going to turn into periodontitis. Is when the tartar is built up under your gum. So you're not going to be able to clean at home yourself. You're going to have to go to your dentist. They're going to numb you. They're going to go deeper into your gums and remove this tartar that is there. So periodontitis can cause bone loss, and bone loss will make your teeth loose. So you might lose your teeth if you don't take care of the periodontitis. So first step, go to your dentist, get your gums clean and check up so you don't have this problem that can be further down the line where you're going to lose your tooth.
So can you just go over again why the yearly checkups are so important for our overall health?
It is very important because the mouth is the gateway to your health.
Mm-hmm.
Thing starts in your mouth. When you take your food, everything goes to your mouth. So if you have a lot of these bad bacteria that cause all this bad breath and cavities, so you don't do the regular checkups, you don't know. You don't know if you are doing a good job. So you have to go to your dentist twice a year. They're going to do the completely thorough checkup. The cleanings will be done by the dentist or the hygienist, where they're
Yeah.
going to go into this scaling. They're going to clean under your gum. They're going to floss. They're going to polish. It's very, very important.
Thank you so much, Doctor. We really appreciate you sharing all of your expertise here with us at Care Experts Live. It's been a pleasure chatting with you.
My pleasure. It was
Yeah,
very good to see you.
thank you so much. So I just want to say, in case you missed it earlier, the CareCredit Let's Get Digital Sweepstakes special secret word is teeth. So now through October 31st, 2023, you can earn entries for your chance to win $5,000 in the Let's Get Digital CareCredit card holder sweepstakes. So enter the secret word teeth in the sweepstakes hub to earn a special 20 entries right now. Head over to the Sweepstakes Hub by simply visiting carecredit.com/let's get digital. No purchase is necessary. A purchase will not increase your chance of winning. Legal residents of the 50 U.S. and U.S. territories, including D.C., 18 and older, who have a CareCredit credit card as of 9/12/2023. Void where prohibited. Promotions start 9/13/2023 and end 10/31/2023. Sweepstakes grand prize and weekly prizes are awarded in the form of a check. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/let's get digital. Sponsored by Synchrony Bank, 170 Election Road, Draper, Utah, 84020. Thank you all so much for watching Care Experts Live, and thank you for everyone who submitted a question. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds and thousands of locations nationwide. Visit carecredit.com for more information. And make sure that you subscribe to our weekly Care Experts podcast on your favorite listening platform, and subscribe to the CareCredit YouTube channel for new podcast episodes every Wednesday. Thank you so much for joining us, everyone. Thank you to everyone who answered and submitted a question. I see Jennifer, Kristen, Daniel, Edgar. Thank you all so much for being here today. We'll see you next time.